An abdominal aortic aneurysm, AAA, is a condition in which the abdominal aorta, the largest artery in the body, becomes abnormally widened or enlarged. An aneurysm is defined as a dilation of an artery that increases its normal diameter by at least 50%. In simple terms, an abdominal aortic aneurysm is a dangerous enlargement of the aorta within the abdomen. In an open repair of an abdominal aortic aneurysm, the surgeon makes a vertical incision along the center of the abdomen. To reach the aorta, surrounding organs such as the colon and small intestine are carefully moved aside to expose the affected artery. Clamps are applied to the aorta above and below the aneurysm. Depending on the size and exact location of the aneurysm, the clamps may also be placed on the iliac arteries. This temporarily halts blood flow, allowing the surgeon to open the aorta safely without excessive bleeding. Once the aorta is clamped, the surgeon makes a vertical incision over the aneurysm, opening the aorta above and below the aneurysm sac. A graft, which is a tube-shaped synthetic vessel, is then positioned inside the aorta. It is secured with sutures at both ends and attached to the healthy sections of the aorta above and below the aneurysm. This creates a stable channel for blood to flow through, bypassing the weakened and enlarged portion of the artery. After ensuring there are no leaks, the aorta is closed over the graft and the clamps are carefully removed. Once normal blood flow has been fully restored, the surgeon begins the closure process. The organs are returned to their original position, and the abdominal incision is closed using sutures or surgical staples.